Hi, I'm Suzanne Hanny. I'm the editor of StreetWise Magazine, and this week we're talking about kidney disease because March is Kidney Month, but also because with universal health care being discussed at the Supreme Court, this is an issue everyone needs to consider, both for humanitarian and public policy reasons. Kidney disease is something that 1 in 9 Americans, 28 million people have, and they may not know it. And another 20 million people are at risk for the disease because of factors such as high blood pressure or diabetes. Why does this relate to homelessness? If someone progresses to end-stage kidney disease, they may need dialysis 3 times a week, or they may need a transplant. If they have a transplant, that's only covered by Medicare for 3 years. So potentially, we interviewed Dr. Craig Langman at Northwestern University Medical School and Children's Memorial Hospital. He had a patient whose Medicare ran out. They lost the kidney and they went back to dialysis. So that's very much akin to homelessness. African Americans are disproportionately affected by kidney disease, and one factor we discussed was poor diet. For example, maternal health care. Babies who are born prematurely, the kidneys aren't developed, they work too hard, they wear out too soon. Illinois, however, is a leader. We may not be able to prevent kidney disease, but if we detect it sooner, we can use drugs and try to do other remediating factors so that people will live better lives. Illinois, since 2005, has had a kidney mobile that offers free education and screening. There's been 30,000 screenings and more than 73% of people have tested abnormal, so there's a very definite need. And I liked the quote we had at the end here from Jim Duffett. He says that we should front load our health system with primary care and preventive care. He said if people are healthier, they are more productive for society, more able to keep employment and pay taxes. The goal should be to keep people healthy and more productive as long as they are on this earth. So that was our primary story, and I'm going to go through some other things in here. I wanted to chat about, we have some writers, we have 2 vendors who wrote. We also have Gary Margolis, who is professor at Middlebury College. He's been one of our writers before on some poetry. Also wanted to chat about the Women Veterans Finding Healing Through Art story. This is an exhibit called Overlooked, Looked Over at the National Veterans Art Museum. The line actually comes from Mae West. She said, "I'd rather be looked over than overlooked." And so it's again a way that these women are able to come back and be better. Opening the vaults, the Mummies exhibit is at the Field Museum through the 22nd. And our executive director wrote about homeless hotspots, a real controversy that there was at the South by Southwest Festival, where homeless people were given hotspot tags and allowed to be tracked. And so we have sort of the pros and cons of this. So I hope you enjoy it, and thank you very much.